segment is sponsored by Virginia Family Dentistry.
We're visiting Virginia Family Dentistry, meeting Dr. Danielle McCormack, talking about periodontal disease. And this is an area of specialty for you, but we're talking about educating friends watching right now who often might have the question of what is a periodontist and what is periodontal disease?
Yeah, and I get that question a lot. So a periodontist is a dentist that has gone on to do additional specialty training in really focusing on everything around the tooth. So that includes the gum tissue, the bone, and the ligaments that all support the teeth. And then we specialize in the placement of dental implants as well.
The signs and symptoms of periodontal disease include?
So the signs and symptoms would include bleeding gums, tender gums. Sometimes they become swollen. The gums can recede, so the teeth would appear longer than they originally did. This can create sensitivity for the patient sometimes, and sometimes there's dental infections or gum infection that happens because of the gum disease that's going on. So that can create a bad taste in the mouth. It can create a bad odor that the patient notices over time. But a lot about gum disease is that, you know, the process, it can go on for a number of years without being noticed if the patient isn't coming in for their regular dental visits, because it really doesn't cause a whole lot of pain in the gums like a cavity would with a tooth that causes nerve pain. So unless the patient is coming in for regular visits with their general dentist, because that's usually when they first notice there's a problem, and then they'll refer the patient to me. If they're not going in for those regular visits, then it can go on for a number of years until the patient finally notices that their teeth are shifting, they're becoming loose, and by that point, it may be too late to treat the gum disease, or it just may take multiple steps to get back to a healthy point again. But if we can't save the teeth, there are also other options as far as replacing teeth with dental implants, which I do.
Dr. McCormack, you see a host of age ranges. This isn't isolated to just the young or the more mature.
That's correct. So I see kids anywhere from the time that they're 7 to 8, and a lot of the time the general dentist or even the orthodontist, if they're getting ready to start treatment for braces, they'll refer the patient over to me because they notice that their gums are a little thin, or it may just be to monitor an area, but sometimes those procedures are less invasive, and it may be something more to prevent bigger problems from occurring down the road. And then I see, you know, patients well into their 90s to, like I said, maintain and treat the gum disease, but maintain the teeth really, or replace teeth with dental implants more for function, so they're not having to have dentures, you know, at that age, and they can chew better.
There are different stages of periodontal disease and different treatment options.
There absolutely is. So some options would include just getting better access to do a deeper cleaning under the gums to get all the bacteria out. Sometimes I can actually repair the bone that's been lost on the teeth. So I can do bone grafts. If the tissue is receding, I can do gum grafts or tissue grafts to cover the roots to help with the sensitivity. If the dentist has had a filling that needs to go more under the gums because the cavity is too far under the gums, then I can do a procedure to lengthen the tooth. But I also do cosmetic procedures as well to treat gummy smiles, and then, you know, placement of dental implants, or even, you know, building the bone in the area if the tooth has been lost for so long of a time that there's not enough bone for an implant. So there's still options, but sometimes we just need an additional procedure to build up the bone before we can actually place the implant.
It's good to know that there are options, and good to know that you can work with a team of professionals, a comprehensive team of professionals at Virginia Family Dentistry. Thank you.
Absolutely. Thank you.
Thank you, ladies. Virginia Family Dentistry is located at 2601 Swift Run Road in Chester, Virginia. Please give them a call at 804-751-0300 or find them online at vadentist.com.